Around 7.4 million people are currently living with a heart and circulatory disease in the UK. Guy's and St Thomas's adult cardiology services care for people who have acquired a heart condition later in life and people who have come into hospital because they've had a cardiac event such as a heart attack. Cardiac imaging is a key part of looking after these patients. It helps doctors to understand how the heart is moving and how the blood is flowing around the body, which is key to diagnosing heart problems and to checking how well treatment is working. Our cardiac imaging unit is a partnership between Guy's and St Thomas's and King's College London. It is a world-leading centre for research into cardiac imaging.
Research is about using advanced imaging for visualizing the heart of patients. And we're trying to do this with better image quality and with much faster imaging. We have invested lots of effort in making imaging faster, so now we can scan a patient in a matter of minutes, and it takes much less than it used to take to acquire a scan. So that's important because it means we can scan every patient, even frail patients. We can identify what's wrong with their hearts, and we can guide treatment in a very specific way, so hopefully we can resolve the problem from the root. Every patient taking part in research makes a huge difference just by contributing with a small bit of information, but that's very important for us.
Mr. Colin Street was diagnosed with coronary heart disease and subsequently went on to have a heart attack and bypass surgery in 1998. He came in for treatment at Guy's and St Thomas's and was recruited to take part in a research study.
It was life-changing to find out that I had coronary heart disease, but as a result I was offered the chance to take part in a research study involving using cardiac MRI scanning. On receiving the information and assessing it, I had no reservation in taking part in the research study and could see the benefits for myself and the future generations. To anyone thinking taking part, I would go for it because it's the best thing you could ever do. You will find that all the research staff are very supportive and kind.
Without patients, we just couldn't do our research. The help and support is vital. As radiographers, we're usually the first people they meet when they come into the department. And our role mainly is to make sure that we're providing them with all the information, going through all their paperwork, and just generally putting them at ease. If you're a patient at Guy's and St Thomas's, you may be asked to consent for research. Now, this may mean that we might take an extra few scans. It may be that we ask you a few questions. It could also mean that it might not involve anything. We just want to use your data for a wider research project. Now, if we do that, we will make sure that any patient identifiable information is removed beforehand. We really appreciate patients who take part in research, especially as they're going through their treatments and diagnosis. We therefore try to ensure that any patient who is taking part in research is having it done as part of their standard care.
As a leading cardiac imaging research centre, we have state-of-the-art equipment and facilities, but that's not all. We also attract the brightest people and researchers in the field of medicine and biomedical engineering. That makes it really exciting to do research here. So if you're taking part in our cutting-edge research at Guy's and St Thomas' Hospital, you're really helping to build the future of cardiac imaging.